All right, hey everyone, and welcome back for another deep dive.
Yes, welcome back.
So today we're going to be tackling a topic that I know can sometimes feel a little daunting, especially for nursing students who are about to head into their clinical rotations.
Oh, absolutely.
We're talking about STIs. So
Yeah.
we're going to really try to give you the need-to-know info, go beyond the textbook basics to,
Ah.
help you feel confident and prepared when you encounter these in real-life patient care.
Yeah, exactly. And we're not just talking about memorizing facts here.
Yeah.
We're going to talk about the stuff that's really relevant for you as nurses, like how to recognize those tricky symptoms, understand the long-term impacts of these infections, and how to provide the best care for your patients.
Exactly. And to make things even clearer, we've got a special guest joining us later who can shed some light on some of those more complex cases.
That's going to be great.
But before we get there, let's just lay the groundwork.
Yeah, good idea.
So, when we talk about STIs, what are we actually talking about? What are we dealing with here?
Well, basically, we're talking about infections that are spread mainly through sexual contact,
Hmm.
and they can be caused by all sorts of things, bacteria, viruses, you name it.
So not just one bad guy we're looking for.
Oh, no, there's a whole gang of them out there.
Whole crew, huh? And I'm guessing they don't all act the same either.
You're right about that. Some, like chlamydia and gonorrhea, they tend to cause, like, discharge,
Hmm.
while others, like syphilis or genital warts, they're more likely to show up as sores or lesions.
Okay, so that's helpful. Right off the bat, we've got discharge versus lesions.
Exactly.
And then, of course, there's the whole bacteria versus virus thing, which I know makes a big difference when it comes to treatment.
Yeah, absolutely.
But before we jump into the specifics,
Yeah.
I've heard this term latent phase thrown around a lot.
Right.
What is that, and why is it such a big deal, especially for us nurses?
That's a really important point, and it's all about how STIs spread.
Okay.
See, the latent phase is like a sneaky, silent period.
Uh,
You can be infected and actually spreading the infection without having a single symptom yourself.
Whoa, so you could be passing it by without even knowing it.
Yep, that's the scary part,
That's definitely something we need to make sure our patients understand.
for sure.
Okay, so let's start unpacking some of the usual suspects here.
Okay, sounds good.
Let's start with one we hear about all the time, chlamydia.
Yeah, chlamydia, it's actually the most reported STI in the U.S.
Really? Wow.
It's caused by this bacterium called Chlamydia trachomatis.
Okay.
And it's interesting, it often shows up alongside its buddy, gonorrhea.
A two-for-one deal we don't really want.
Right. And that definitely makes things a bit trickier when we're trying to diagnose it.
I bet. So what kind of symptoms should we be looking out for with chlamydia?
Well, for men, it often shows up as painful urination and discharge. But
Mhm.
for women, it can be a lot more subtle, sometimes even no symptoms at all.
So a lot of women walking around without knowing they have it.
That's why regular screening is so important.
Makes sense. And if it's not caught early, what kind of complications can chlamydia lead to?
Well, for men, there's epididymitis, which is basically inflammation of that tube at the back of the testicle.
Ouch.
And that can actually lead to infertility in some cases. And for women, the big concern is PID, pelvic inflammatory disease, a serious infection of the reproductive organs.
So we definitely want to catch this one early.
Hmm.
How do we test for chlamydia?
The most reliable test is a DNA amplification test, or NATE.
Got it. And how about treatment?
Usually it's doxycycline or azithromycin. Both antibiotics work pretty well.
Okay, sounds good. So
Okay.
let's move on to chlamydia's partner in crime, gonorrhea. What's the deal with this one?
So gonorrhea is the second most reported STI, and it's caused by a different bacterium this time, Neisseria gonorrhea.
Okay, a new name to remember.
But like chlamydia, it can be sneaky too, especially in women.
Ah, so more silent infections.
Often.
Yeah,
Yeah.
so vigilance is key. But when there are symptoms, what should we be looking for?
In men, you usually see that classic painful urination and discharge, which can be pretty thick and pus-like.
Uh-huh.
But women, it might be a bit more subtle, maybe some increased discharge or spotting, but often nothing very noticeable.
Which again highlights the importance of testing.
Exactly.
What happens if gonorrhea isn't treated? What kind of complications are we talking about?
Similar to chlamydia, actually,
Okay.
men can get epididymitis and potentially even infertility, and women can get PID, which can lead to chronic pelvic pain, scarring, and even ectopic pregnancies later on.
Oh, wow. So some serious long-term consequences there.
Yeah.
What about diagnosing and treating gonorrhea? Is it the same as chlamydia?
Well, the tests are similar. We can use cultures, gnats, or even a gram stain.
Okay.
But treatment is a bit different. We usually go for a dual therapy approach with ceftriaxone and azithromycin.
Why both? Is that because of resistance?
You got it. We've seen more and more resistance to ceftriaxone alone, so adding azithromycin helps to make sure it works.
Smart. And another thing I remember about gonorrhea is contact tracing, right?
Oh, absolutely. That's crucial.
We got to break that chain of transmission.
You don't want people just passing it back and forth.
Exactly.
Right.
We need to get everyone treated.
Yeah.
So much information already, and we've barely scratched the surface.
I know, right?
And there's some STIs that are even more challenging to diagnose and manage.
Oh, yeah, definitely.
That's why I'm excited to bring in our expert who can help us navigate those trickier cases.
Perfect timing. Welcome to the deep dive.
We're so glad to have you join us.
Thanks for having me.
So let's dive right in. What about trichomoniasis? I feel like I haven't heard as much about this one as chlamydia and gonorrhea.
Yeah, it does tend to fly under the radar a bit, but it's actually one of the most common STIs in the U.S.
Really? Wow.
And here's something interesting. It's more common in women over 25 than in younger women.
Oh, that's unexpected. Why is that?
Honestly, we're not entirely sure, but it's thought that hormonal changes with aging might have something to do with it.
Okay, interesting. And another thing that's important for us nurses to know is that transmission can happen even without ejaculation.
That's right. It's not just about fluids.
Wow, okay. That's definitely something we need to be educating our patients about.
Right.
What about symptoms? What should we be on the lookout for?
Well, trichomoniasis can be a bit of a chameleon. Some people have no symptoms at all.
Oh, great, more asymptomatic cases.
Right. But when symptoms do appear, they can range from mild to pretty severe.
Like what?
Think painful urination, itching, a frothy discharge that might be greenish, even a fishy odor. It can really vary.
Okay, so lots of different presentations. That makes it even more important to have a high index of suspicion.
Mm.
What are our treatment options for trichomoniasis?
The good news is we have effective medications for this, one metronidazole or tinidazole, either orally or intravaginally.
So kind of similar to BV in terms of treatment.
Yeah, there are some similarities there.
All right, let's keep moving through our STI list. What's next?
Let's talk about genital warts. These are caused by human papillomavirus, or HPV. And there are a ton of different HPV types out there, but about 40 of them can affect the genital area.
So it's not just one virus, but a whole family of them. Are they all equally concerning?
Not at all. Some types are pretty harmless and they clear up on their own. But others are considered high risk because they can lead to cancers like cervical vulvar, vaginal, even penile and anal cancers.
Oh, wow. Okay, so knowing the specific type is really important. What do these genital warts actually look like? What should we be looking for?
They're basically small growths that can be flesh-colored, white, pink, even brown. Sometimes they're single, sometimes they cluster together and look kind of like cauliflower.
Cauliflower, got it.
Yeah.
And where do they usually appear?
That depends. In men, you might see them on the penis scrotum, around the anus, even inside the urethra. For women, they can show up on the vulva, vagina, cervix, and perianal area.
Okay, so location matters. How do we diagnose and treat genital warts?
Diagnosis is usually visual just based on how they look. Treatment aims to remove the warts, and we can use chemicals or ablative methods for that. But it's important to note that treatment doesn't actually get rid of the virus itself.
So there's a chance they could come back.
Yes, recurrence is possible, and reinfection is also possible.
Makes sense.
Mm-hmm.
So long-term follow-up and patient education are key.
Absolutely. And speaking of prevention, this is a good time to bring up the HPV vaccine.
Oh, right, the vaccine. That's a game changer, isn't it? I know there are a few different types out there.
Yes, there are currently 3 vaccines available that protect against the most common cancer-causing HPV types. And ideally, they're given to young people before they become sexually active.
Makes sense. All right, let's switch gears now and talk about another STI that has a long and complicated history. Syphilis.
Ah, syphilis. This one is caused by a bacterium called Treponema pallidum, and it's a bit unique because it's a spirochete.
A spirochete, what's that?
Basically, it's a spiral-shaped bacterium that's really good at burrowing into tissues, which is why syphilis can be so invasive and go through these distinct stages.
Okay, that sounds intense.
Right.
How is syphilis usually spread?
Sexual contact is the most common way, but it can also be spread through direct contact with sores and less commonly through needle sharing. What's really important for nurses to understand is that if syphilis isn't treated, it can progress through these 3 stages, each with its own set of challenges.
Okay, so walk us through those stages. What should we be looking for?
The first stage starts with a sore called a chancre. It appears where the infection first got in, and it's usually painless.
Painless. That seems dangerous.
It is. People might not even realize they have it, which makes it more likely to spread. And without treatment, syphilis moves on to the second stage, where things get more systemic.
Okay, so what happens in the second stage?
You start to see flu-like symptoms like fever, headache, fatigue, and then there's a rash that can appear all over the body, even on the palms of the hands and the soles of the feet.
Okay, so at that point, it's pretty clear something is wrong. But what if it still doesn't get treated?
Then it progresses to the late stage, and that's where things get really serious. We're talking about damage to organs, the cardiovascular system, even the nervous system.
Wow, that's scary stuff.
Yeah.
So catching it early is crucial. How do we diagnose syphilis?
We use blood tests called serologic tests that detect antibodies to the bacteria.
Got it. And how do we treat it?
The gold standard is penicillin G, usually given as an injection.
Okay, penicillin, noted. This has been a great overview of some of the most common STIs.
And we're not done yet. There's so much more to talk about.
I know, right? I'm already feeling overwhelmed.
Well, that's why we brought in our expert.
Yes. Perfect timing.
They can help us really unpack some of these more complex aspects of STIs, especially those that are super relevant for nursing care.
I'm ready. Let's bring them in.
All right, welcome to the deep dive.
We're so excited to have you here to share your expertise.
Thanks for having me. Happy to be here.
Let's jump right into it. We've talked about the basics of some of the most common STIs, but now I want to get into the nitty-gritty.
Okay,
The pathophysiology of these infections.
the how and the why.
Exactly. What's going on inside the body? How do these infections actually work?
Great question. And I think it's really fascinating stuff.
I agree. I'm ready to geek out a bit.
Perfect. So let's start by going back to syphilis for a second.
Okay.
Remember how we talked about those distinct stages?
Mm-hmm.
Well, those stages are directly related to how Treponema pallidum, that bacterium that causes syphilis, interacts with the body's immune system.
So the stages aren't just random. They're part of this bigger battle that's happening.
Exactly. Think of the primary stage with that painless chancre as the first line of defense.
Okay.
The body is trying to contain the infection, but Treponema pallidum is sneaky.
Sneaky out.
Well, it can actually change its surface proteins.
Oh, wow.
Which makes it harder for the immune system to recognize it and attack it.
It's like it's disguising itself.
Exactly. So it manages to slip through the cracks and spread to other parts of the body.
That's how it progresses to the secondary stage then.
Right, but then the question is, why doesn't the immune system just wipe it out completely?
Yeah, good question. It's already fighting back, right?
Right. And that's what's so fascinating about syphilis. For reasons we don't fully understand, Treponema pallidum can actually hide out in certain tissues and organs.
It's like playing hide and seek with our defenses.
Exactly.
Yeah.
And it can stay there silently causing damage, which leads to the latent stage.
So even though the outward symptoms might go away, the bacteria is still lurking.
Still there. And that's when those serious complications can happen if it's not treated.
The gummas,
Yeah.
the heart problems, the neurological damage,
Right.
like a ticking time bomb.
That's a great way to put it. And that's why understanding this whole progression is so important for nurses.
Right.
Knowing what to look for at each stage, recognizing the importance of early detection and treatment, it can make a huge difference for our patients.
We're not just treating an infection. We're potentially preventing all these long-term health issues.
Exactly. And let's not forget about the emotional impact, too.
Oh, that's so important. STIs come with a lot of stigma,
Yeah,
which can make it hard for people to open up and seek help.
absolutely. We need to be sensitive to that and create a safe space for our patients to share their concerns without judgment.
Building trust and rapport is so essential.
It's not just about treating a disease, it's about caring for the whole person.
Holistic care, addressing both the physical and emotional needs.
Right. Sometimes that might even mean connecting patients with additional resources like support groups or mental health professionals.
Absolutely. We're part of a larger support system.
For sure. Now, while we've been focusing on the individual patient,
Yeah.
it's important to remember that STIs also have these broader public health implications.
Right. They don't just affect one person in isolation.
Exactly. They impact whole communities.
Yeah.
And as nurses, we have a responsibility to advocate for policies and programs that promote sexual health and prevent the spread of STIs.
What can nurses do on that community level?
Well, we can educate our patients about safer sex practices, encourage regular STI testing, and advocate for increased access to affordable healthcare and testing services.
Those are all really important steps. And we can also work to reduce the stigma surrounding STIs.
Oh, absolutely. Stigma is a huge barrier to effective prevention and control.
People are afraid to talk about it.
Right. They're afraid to get tested. They're afraid to tell their partners.
It's all connected.
Exactly. We need to create a culture where people feel comfortable talking about sexual health and getting help when they need it.
And that reminds me of something you said earlier about the importance of education, especially for teenagers.
Yes. Young people are especially vulnerable to STIs,
They are.
often because they lack knowledge, access to care, and they face a lot of social pressure.
It's a tough combination.
Right. We need to start having these open and honest conversations about sexual health early on.
Age appropriate, of course.
Of course. But these conversations should give young people the information and resources they need to make informed decisions about their sexual health.
Informed decisions about their bodies and their relationships.
Exactly. And that includes teaching them about consent communication, healthy relationships. These are all key parts of sexual health.
Couldn't agree more.
Hmm.
This conversation has really highlighted just how multifaceted the role of a nurse is when it comes to STIs.
It really is.
It's not just about the clinical knowledge.
Mhm.
It's about communication, empathy, advocacy, and a real commitment to public health.
Well said. We're on the front lines of this issue,
We are.
and we have the power to make a real difference in the lives of our patients and in our communities.
I love that. That's a great note to end on.
It is.
So, listeners, thanks for joining us on this journey through STIs. We hope you found this episode informative and empowering.
Remember, knowledge is power.
It is.
And together, we can make a difference in the fight against STIs.
Until next time, stay curious and stay informed.
It really is.
It's not just about the clinical knowledge.
Hmm.
It's about communication,
Mm-hmm.
empathy, advocacy, and a real commitment to public health.
Well said. We're on the front lines of this issue. And we have the power to make a real difference in the lives of our patients and in our communities.
I love that. That's a great note to end on.
It is.
So, listeners, thanks for joining us on this journey through STIs. We hope you found this episode informative and empowering.
Remember, knowledge is power.
It is.
And together, we can make a difference in the fight against STIs.
Until next time, stay curious and stay informed.
That's so true. It's inspiring to think about the impact we can have as nurses. You know, we've talked a lot about the big picture, but let's zoom back in on the clinical setting for a minute.
Okay.
What are some practical tips for nurses who are actually working with patients who have STIs? Like, what should we be keeping in mind?
That's a great question.
Yeah.
I think the most important thing is creating a judgment-free zone. You know, patients need to feel safe and comfortable discussing these sensitive issues with us.
So active listening, empathy, a non-judgmental attitude, that's the foundation. Exactly. And remember, patients might be experiencing a whole range of emotions, fear, shame, anger, denial. It's our job to meet them where they are and provide support and guidance without judgment.
That makes total sense. Now, shifting gears a bit to the physical assessment,
Yeah.
are there any specific things we should be aware of? Any red flags to watch out for?
Well, a thorough assessment is crucial, of course.
Of course.
So that means getting a detailed sexual history, paying attention to any symptoms the patient reports, and conducting a physical exam.
Okay, and during that exam, what are some things that should raise a red flag?
It really depends on the specific STI we're suspecting. But in general, we're looking for things like discharge, lesions, rashes, swollen lymph nodes, anything that's out of the ordinary. It's also important to check for any signs of complications, like pelvic pain or abdominal tenderness, which could indicate something more serious is going on.
Right, and of course, we can't forget about infection control.
Oh, absolutely. Standard precautions are a must for all patients, but they're especially important when we're dealing with STIs.
So gloves, hand washing, properly disposing of contaminated materials, all the basics.
Exactly. Got to protect ourselves and our other patients.
Right, and then there's patient education, which is a huge part of our role.
Huge. We need to make sure our patients have clear and accurate information about their diagnosis, their treatment options, and how to prevent transmission.
So explaining things in plain language, answering their questions patiently, making sure they understand why it's so important to finish their treatment and to notify their partners.
All of that. And we also need to be sensitive to the fact that some patients might be hesitant to disclose their status to their partners. It can be a really tough conversation.
They can. And we might be the only ones they feel comfortable talking to about it.
Right. So we can offer support and guidance on how to navigate those conversations, how to approach the topic, how to answer questions. Honestly, just being there to listen can make a world of difference.
I think that's something we often underestimate, the power of just listening.
It's huge. Sometimes that's all someone needs.
This has been such an incredible conversation, honestly. I feel like we've covered so much ground.
We have. And I hope it's been helpful for everyone listening.
I'm sure it has. It's given me a much deeper understanding of STIs and how much of an impact we can have as nurses in their prevention, diagnosis, treatment, and management.
Absolutely. And, this is really just the tip of the iceberg.
Oh, I know.
There's so much more to learn about this field. It's constantly evolving.
It is. So it's our responsibility to stay curious, stay informed, and stay committed to providing the best possible care for our patients.
Well said. I couldn't have said it better myself.
Well, on that note, I think it's time to wrap up this deep dive.
Sounds good.
Thanks for joining us on this journey, listeners. We hope you learned a lot and feel more confident about tackling STIs in your nursing practice.
Remember, knowledge is power.
It is. And we can make a difference in the fight against STIs. Until next time, stay curious and stay informed.